Okay, so the next bone we're going to be looking at is the ethmoid bone. If you look on the ethmoid bone, if we're looking right into the nose, you'll see right up in here, let's see if we can, right here and here, I have the middle nasal conchae. And that's part of the ethmoid bone. Now, it's not on the skull, but up higher, I actually have the superior nasal conchae in a person. Those are part of the ethmoid bone. Below that, I actually have some more nasal conchae. These are the inferior nasal conchae right here and over here. And the inferior nasal conchae are separate bones. They're not part of the ethmoid. So the middle and superior nasal conchae are part of the ethmoid, but not the inferior nasal conchae. They're their own separate bones. In the middle, this is the nasal septum right here. That's the nasal septum. And on the nasal septum, the superior portion here is actually the ethmoid bone. The bottom portion's the vomer. But I do have the ethmoid bone right here. Now, if I turn this over from this angle, you can see we have in the middle, this is all frontal bone right here, but in the middle, I also have the ethmoid bone right in here. The part that sticks up is the crista galli, and on each side of the crista galli, I have the cribriform plate. The cribriform plate is where bones are in the ethmoid, or I'm sorry, holes are in the ethmoid bone that allow the olfactory nerve to pass through, so the olfactory nerves can go to the brain and you can smell. The crista galli, the brain actually attaches to the crista galli, the part that sticks up, and the brain attaches to it, and that helps keep the brain in place. And that's the ethmoid bone. Oh, and one other thing is the ethmoid bone is on the medial side of the eyes, and on this skull you can't see it, but it's on the medial side of the eye socket. It helps make up the medial side of the eye socket.